In this short video, I'm going to be talking about point mutation and giving you some examples of genetic diseases that are caused by point mutation. Generally, point mutation is a genetic alteration that occurs with just a single nucleotide in a DNA sequence. It gets substituted, inserted, or even deleted. And with such mutations, they can alter the function of that gene and potentially lead to genetic alterations or diseases. A good hematological example would be of sickle cell anemia, and even we can think of a blood disorder called hemophilia A. But let's talk about sickle cell anemia. Sickle cell anemia is caused when a single nucleotide substitution occurs in the hemoglobin gene, specifically on the beta globin gene. And this occurs on chromosome 11. Specifically, the substitution occurs with the A and the T on the DNA sequence, or the adenine and the thymine. This happens within the 6 codon, and it changes the codon from GAC, or glutamic acid, to actually GTG, which is valine. So what happens when this occurs in sickle cell anemia? The overall effect is the result which will happen when an abnormal hemoglobin occurs. We have hemoglobin S. This causes the red blood cells to then assume a sickled shape. And with this sickled shape, it's going to lead to poor oxygenation transport and actually could even block blood vessels. It can become very painful for some patients. Another example would be in cystic fibrosis. The most common mutation that occurs in cystic fibrosis is within the CFTR gene, which involves the actual deletion of nucleotides. And this results from the loss of phenylalanine at the position 508. However, point mutations such as G551D can also cause cystic fibrosis. What's the overall effect? They will disrupt chloride ion transportation across cell membranes, and this is what leads to the thicky, sticky mucus that is found in the lungs of cystic fibrosis patients. It can also cause disruption in the digestive system as well as other organs. The last disease that I want to talk about is PKU, or phenylketonuria. And actually, this was a disease that we would catch in many young patients, infants. And we used to call the newborn screen the PKU test because it was testing specifically for this. But now the newborn screen can catch many other significant diseases. Anyways, getting back to PKU. The cause of PKU occurs on the mutation of the PAH gene. And this is a substitution of the guanine, or the G, within the adenine, or A. And it impairs the enzyme phenylalanine hydrolase, or hydroxylase, from forming phenylalanine hydroxylase. So the overall effect is accumulation of this phenylalanine in the blood, causing intellectual disability, further developmental delays, and can cause other neurological issues if not treated early. And this is why the newborn screen picks up diseases like PKU. Think about other types of diseases caused by genetic point mutations as you consider the